Becky. She is 6 years old. She is coming in the ER with a UTI. She has had 5 UTIs in the past 3 months. Her mom thinks that there might be something else wrong. We're just going to have to check. Here's the nurse coming.
Hello,
Hey,
my name is Kelly.
my name is Kim.
I'm going to be your nurse today. And who is this?
Her name's Becky.
Hello, Becky. I'm Kelly. I'm going to be your nurse. How old is Becky?
She's 6.
6 years old? All right, well, we're going to start out getting some vital signs, and then we'll find out what's going on with her here, okay?
Okay.
I'm just going to listen to her first. We're going to do a blood pressure on you, Becky. Blood pressure is 120/80. Her lung sounds were good and clear. I'm going to take your temperature now, Becky. Temperature's 98.9.
I just gave her some Tylenol before we came.
Okay. And how long has that been?
A couple hours.
Okay. Children's Tylenol.
Yes, ma'am.
Pulse is 88. Okay. So, what is your complaint today? What's going on with her? What brings you in?
Well, she's been running a little bit of a fever.
Okay.
And she's had some burning and stinging when she's going to the bathroom.
Okay.
She's been complaining of her abdomen hurting a little bit.
Okay. And how many days has this been going on?
About 2 days.
2 days? And besides the Tylenol, have you done anything to treat it at home? Have you tried anything else?
No, ma'am.
Okay. Does she take any medications besides Tylenol?
She doesn't.
Okay. And is she allergic to anything?
She's allergic to penicillin.
Penicillin, okay. What about latex allergies?
No.
Any food allergies?
No.
Any environmental allergies?
No.
Has she ever had any kind of surgery?
No, she hasn't.
Okay. Has she ever been diagnosed with any childhood illnesses, diabetes, asthma, any heart problems going on with her?
No.
Okay. What about in your family? Do you or your husband or any siblings have anything?
Her grandparents both have high blood pressure and
Okay.
heart disease.
Okay. How's her diet? She good?
It's been a little poor the past couple days.
Okay. Have you noticed with her urine, is it frequent?
Yeah, she's been going to the bathroom a lot.
Okay. Does she complain of burning or stinging when she goes?
Yeah, she says it hurts when she goes.
Okay.
And I've noticed a little odor.
Foul odor? Okay. And you said she was having abdominal pain?
Yes,
Is it in one area or just kind of generalized?
just in the lower abdomen.
What about her back? Any pain in her back?
She says it comes to the side sometimes.
Okay. Have you noticed any having accidents on herself during the day or any kind of bedwetting at night?
No, but she does like to hold her urine in during the day.
Okay. Okay. All right. So what I'm going to do is I'm going to get all of this charted, and then Dr. Elise is going to come in and do an exam of her, and then we'll go from there, okay?
Okay, thank you.
Yes, ma'am. If you need anything, just let me know. There's your call light.
Hey, Miss York, I'm Dr. Elise.
Hey.
So what seems to be the problem today?
Well, she's been having some burning, stinging pain when she's going to the restroom. Her abdomen's been hurting her. She's been running a little bit of a fever.
And how long has this been going on?
About 2 days now.
And how high did the fever get?
It got up to 101 before we came, and I gave her some Tylenol.
Okay. I'm gonna just take a little list. Now it says she's allergic to penicillin.
Yes,
right?
ma'am, that's correct.
I'm just going to order a few labs, just a urinalysis, because it sounds like a UTI, so.
Okay.
And we'll go from there.
Okay.
Hi, I'm Anastasia from the lab. I'm going to take a urinalysis, a urine culture, and I'm going to probably take her down for a renal ultrasound.
Okay.
That sounds scary, but it's really not. The urinalysis and the urine culture, we're going to see if there's any bacteria in her urine.
Okay.
And the renal ultrasound, we're just going to take some pictures of her kidneys and her bladder.
Okay.
Do you have any questions?
I don't think so.
Hey, Miss York. Her urinalysis came back, and she is positive for E. coli. So that's indicative of a UTI. Generally, UTI tract is sterile, and so when a bacteria gets in it, it causes it to have an infection.
Okay.
I'm going to prescribe some antibiotics for it. We're going to try Bactrim, because you said she was allergic to penicillin, right? She isn't allergic to sulfa drugs or anything.
Not that we know of.
Okay. And I'll let the nurse come in here and tell you about the antibiotic and then talk to you about some preventions, okay?
Okay.
Hey, Miss York. So the doctor has wrote a prescription of Bactrim. It's an anti-infective, anti-protozoa antibiotic that we usually give for this. It just helps with the suspectable bacteria that was found in her. Now, some side effects that could be present from this that you'll want to watch for is just some nausea, vomiting. That's kind of normal with this. Stomach upset. We do prefer that they take this medication with a full stomach. That'll help prevent the stomach upset, maybe a glass of milk, something like that. The main thing, though, with any kind of antibiotic is that you have to make sure that she takes it every day and take it until it's finished. Even if she starts feeling better and her symptoms go away, she still needs to continue the whole thing.
Okay.
Otherwise, her body could build up a resistance to it. Don't be surprised if she does have a little diarrhea with this antibiotic as well.
Okay.
That is normal. But if she presents with any kind of symptoms and you think maybe she's having an allergic reaction, then you certainly call your doctor's office or come back to the ER right away.
Okay.
Okay?
She's had this so often. What can we do to, is there something that we need to do to prevent
Sure.
this?
There's several things that you can do to prevent a UTI, especially with little girls. It tends to be more common with them. The number one thing is when they go to the bathroom and they wipe, always make sure they wipe from the front to the back. That keeps from spreading bacteria forward into the urethra. Plenty of fluids. That helps to keep the urinary tract flushed out. Make sure they don't get dehydrated.
What about her bathing? She loves to take bubble baths.
Yeah, we don't usually recommend bubble baths. That tends to irritate the urethra, the soaps and the perfumes and the dyes that's in there. We prefer showers. Also, cotton panties. Some of these other synthetic things that are out there on the market aren't usually recommended. No tight pants, no tight jeans. I know she's young and she's only 6, but when she does start her menstrual cycle, you'll want to make sure you encourage her to change her sanitary napkin frequently. That'll help prevent them in the future. Anything else that I can help you with? Any other questions that you have?
What about her diet? Is there any certain foods or anything that?
There is research that says cranberry juice helps, and then there's research that says it doesn't, but it does help to clean out the urinary tract, so you can try that. We always encourage a healthy, well-balanced diet for anything low in fat, low in sweets and sugars, because those things as well can irritate the UTI. So.
Is it okay if she still drinks her Cokes?
Well, with a child her age, we don't recommend Cokes, especially caffeine. We prefer water and not a lot of fruit juices as well because of the sugar.
Okay.
Any other questions that you have?
That's it.
Okay. Well, let me get her prescriptions for you, and we'll get her discharged and get her out of here, okay?
Okay, thank you.
Yes, ma'am. And like I said, if you have any further problems, don't hesitate to bring her back to the ER.
Hey, Anastasia from the lab again.
Hey.
I have those blood sugar levels. Are you ready for them?
Can you give me just a few minutes? I'm trying to finish up this care plan on this patient.
Alrighty.
If you've got another patient you can go see and come back, I'll be done in just a few minutes.
Alright. If you need me,
All right.
call me in the lab.
Okay, thanks. Okay, let's see. Potential nursing diagnosis related to urinary tract infection. includes impaired urinary elimination related to urinary tract infection or other urologic condition, or other factors such as ignoring urge to void at appropriate time, evidenced by urinary retention or incontinence, dribbling, urgency, or dysuria. Let's see, another one. Knowledge deficit related to lack of information regarding the medical condition, prognosis, treatments, and preventative measures as evidenced by verbalization, questions, or actions demonstrating lack of understanding regarding the child's condition or care. And lastly, urinary retention related to anatomic obstruction, sensory motor impairment, or dysfunctional voiding as evidenced by dribbling, inadequate bladder emptying. There, that should do it.